Today we are starting off a three-part series about winning the recruitment war in healthcare. And really on a broader scale, it's going to really be winning the talent war overall in healthcare. Part one today is focused on really getting talent interested. Work has really changed a lot over the last 5 years, let alone the last 20 years. Today we have 4, some actually say 5 generations in the workforce, which are really forcing us to rethink our organization structures, our models, the hows and the whys of what we do, and the process specifically around recruiting talent. The roles themselves are also changing, and so while the expectations and the title may not have shifted as much, the roles and the technical competencies of a lot of the roles, especially in healthcare, are continuing to change at a really rapid pace. And sometimes the availability of that talent is not outpacing the need that we have for them in organizations. Sorry about that. So first, let's just start off by looking at the state of hiring in healthcare today. Most of you on this call are in some way or another responsible for the talent, whether it's talent management or engagement strategies or recruiting specifically. And so you're intimately involved with some of the challenges, but let's look at this at a little bit holistic level. As a healthcare industry, we are adding number of people regularly. Every single month, they're adding more and more. However, we're still facing high levels of burnout, high levels of disengagement, and high levels of turnover of our existing staff. More than half of the people that we hire this year will leave within the next 2 years. And the earlier they are in their career, the more likely they are that that's going to happen. Nursing turnover specifically is costing healthcare systems upwards of $8 million a year. Over the last couple of years, we've really seen a spike, though, in hospital job growth. For a long time, we stayed pretty level with our numbers from 2010 really to about late 2014. And then late 2014 into 2015 and continuing on, Bureau of Labor Statistics shows that we've had a sudden surge in hiring within the systems. But the shortages that are taking place are still very real. For the first time in a number of years, the shortages of staff has become a larger issue than the healthcare reform, according to healthcare execs as of November 16 research. 42% feel that that is a larger issue than the reform. 72% found that the supply of primary care physicians is really inadequate to meet the needs over the next 3 years. And 51% say on top of the primary care physician shortages, they don't have enough healthcare extenders, so nurse practitioners, physician's assistants, and other key roles that they're trying to hire. Specifically, nurses is a huge issue that all healthcare systems are facing. If you look at the vacancy rates just over the last 5 to 8 years, you'll see a huge increase. Specifically, the 10% or greater vacancy rate was 32.9 or 33% in 2016, and it was under 5% just in 2012. If it feels like it's getting a lot harder to find and hire the people, it's because it is. So when we start talking about employment branding and candidate experience and how do we know if we're attracting the right people, one of the common things that I get from feedback from corporate as well as from healthcare talent executives is how much impact can actually happen before somebody hits the apply now? Shouldn't we be more focused on what happens once they join the organization, or shouldn't we be more focused on what happens through the interview process? And the answer to both of those is yes, you should be focused on those, but it's really surprising how much activity and things happen before somebody even hits that Apply Now button. If we look at kind of the candidate life cycle before they hit apply, it's a lot more complex than it has ever been in the history of job seeking. So when somebody decides to consider a new role, there's all of these new different avenues that take place. They start asking around for options. They connect with people on Facebook. They talk to people they know that work for other healthcare systems. They ask, hey, what do you think of working here? Or what do you think of that organization? Or what have you heard? And in healthcare, it's even more so because they talk to anybody they know that has actually been a patient as well. So there's a lot more conversation going on about that. Then they filter through their own opinions and perceptions, and that's really where the employment brand is key. What you put out or what the perception is of you in the marketplace really does become a reality on if people are going to apply or what they feel like it's really like to work there. Next, they're going to check out a few career sites. They're going to read some of your job postings. They're going to see how you talk about the employees, how they talk about your organization. And finally, they're going to check out Glassdoor and get a good feel for what's it really like to work there. And if you aren't familiar with Glassdoor, we'll dive a little bit into it shortly. But what Glassdoor is, it's a website where people can go and review what it's like to actually work there. And it's had huge increases over the number of years. And all of that happens before somebody even clicks apply. There's some really interesting research going on right now in the travel industry. And I know it's a little bit of a departure, but the research is starting in recruiting, but it's too early to talk about. But when we start looking at travel, they start looking at how many different touch points people are having before they actually go to book. So how many different places and how many different areas and times are they seeing the brand of a hotel or the brand of a theme park or the brand of a cruise line before they actually decide to plan and make that next move. And in some cases, that number is upward of 400 or 500 hits or views or insights that are going on around them. And for job seekers, it's no different. Every day they're inundated with driving by somewhere or talking to somebody, and it's the same type of impact that we're seeing. One of the big reasons for this is because it's no longer about social networking. We talked about Facebook and Twitter and how we should be positioning on these for a really long time. But what's happened is we've really shifted as a society away from just social networking to social living. Everything has really become more social. Overall, as a society, we have more than 10 billion Snap views each day. And if you aren't familiar with Snapchat, it's almost like taking a quick picture or an image and you can write on it, and then you send it out to a group of people, like a text message, but it's private, and then it disappears after a short period of time. And it is growing substantially because people want to have that immediate connection. There's more than 100 hours of video that get uploaded to YouTube every single minute, and adults over 45 are not only just the fastest growing users of Snapchat, but one of the fastest growing users of all of the social networks. That sharing of information and sharing of who we are and in our lives and knowing what other people feel about different aspects of everything is becoming more and more key. In HR, we're seeing this not just in recruiting, but in all other aspects of talent management. So the candidate experience, recruiting, sourcing, employment branding is really clear on where it is, but it carries over, and the impact that we have with this carries over into our team building and our engagement and the retention and learning. Even wellness programs now we're starting to really see link via social. And so looking at social as something that is part of a candidate's life, not just a place they go, is becoming more and more key as we start talking about attracting and engaging the right people. Social is also really mobile, and this is a big shift that has happened over the last just handful of years. It really wasn't until 2010, 2011 that we saw this quick uptake of mobile and smartphones, and now so many people work primarily off of their iPhone or device, and it's crossing generations. So the adoption of the technology is bridging gaps, and if you are an organization that is trying to recruit and hire not just the recent grads, but maybe recruit people that have retired and you're open to having them work part-time or that are phasing out of that full-time work, it's a really great thing to make sure that you're looking at from a strategy perspective. Boomers are the fastest growing user of mobile devices. Seniors are right behind them. And 27% of seniors have a tablet or e-reader, where only about 17% have a smartphone. So as you're looking at your processes and applications and your information and how you're sharing that information out there, make sure that it's mobile capable and mobile friendly. Another area of conversation that is important to bring up as we talk about mobile and social and kind of all of these early parts of the puzzle that meet the foundation for candidate experience and for employment branding is talking about the disparate impact of mobile. And for a long time, there was a thought or a belief that mobile was targeting more of a affluent group, and they wanted to make sure that they were able to reach all sides. And what we've actually seen with the commonality of iPhones and smartphones and the cost reduction of those type of plans versus the cost increase of home internet is that we're seeing more and more people, candidates, employees, are actually only able to access information via mobile. And so we have an entire certain segment of the workforce that are mobile exclusive. And in healthcare, a lot of times we spend a lot of our focus on doctors and nursing shortages, but we're finding just as much problem with our housekeeping staff and with our LPNs and with people that work in the cafeteria and in some of the other areas that are not always focused and talked about as much from a healthcare perspective. When we look at how many families and households are mobile only, if you're looking at people that are earning over $100,000 a year or more, it's only about 15% that don't have internet at home. But when we look at people that are between 50 and 100,000, it jumps to 35%. And when you look at families that are making under 50,000, it's an even greater increase beyond that. So just having all of these different pieces in mind as you start thinking about, are we actually attracting the right people? Are we making it really accessible? Are we making it easy for them to be reached? So how is this all coming back? And I think the feedback impact is something that I think social and mobile and all of these different pieces are really coming into play. And as a foundation to setting up employment branding, talent attraction strategies, all of this stuff is really important to understand. Think back to the last week. How many times were you using Yelp or OpenTable or TripAdvisor or looking at a review for something that you were wanting to do? Maybe it's a little further back because you were looking to your last vacation and you were trying to decide what hotel to use, or you were looking to figure out where you were going to go out to dinner for the weekend or plan something special. When we start thinking about it, it's really been a very short time that we started to not only desire the feedback and understand the views of what other people thought and the ratings about this, but also we felt the need to really share that information ourselves. And there's all sorts of reasons why people think this is happening, but at the baseline of it, it is. And we're seeing it in the job searches as well. And Glassdoor is a really great example. There are other type of feedback sites out there, but Glassdoor definitely is the most popular. There's more than 30 million users that are on Glassdoor. More than 10 million people have actually uploaded reviews about their organization online. And healthcare is not being left out of this. We are seeing more and more hospital systems and healthcare systems starting to be reviewed and rated on Glassdoor. And it will review everything from what's the interview process like, how is the application process, all the way to rating the CEO and what is it actually like to work there? How happy are the people and salaries and all of these other aspects of it. It's a global phenomenon too. It is not something specific to the U.S. and it is definitely not something specific to just larger cities. We see this in even the most rural areas use Glassdoor pretty effectively. So if you haven't had a chance to make sure you go check out your Glassdoor reviews and ratings, it's a very interesting thing to do if you haven't seen them before. So where does this all leave us to? You know, we talked about the baseline, but when it really comes down to attracting the right people, it comes down to the experience and the candidate experience. And there's so much conversation going on about this topic in the last few years. And in healthcare, we talk a lot about patient satisfaction and we talk about employee engagement. And a new thing to add into that really is on the candidate experience. I would say in healthcare specifically, we have seen an adoption rate for candidate experience in the pediatric and children's hospitals a much faster and earlier level than in some of the other healthcare systems. For the most part, not just in healthcare, but in all areas of hiring, it's really a little bit about candidate non-experience, where people just really don't care. And there's a belief that, what happens? What's the big deal? Really this, again, because of this feedback society that we're living in and because of the social living that we have now, when candidates have a bad experience, it really is impacting you guys as a healthcare system or an organization. More than 42% of the candidates that have a bad experience will never seek employment at that company again. Healthcare systems are small, and it's a lot of people that move between systems, and especially if you're in towns where there aren't as many options, a lot of times you're trying to recruit back people or you're trying to hire somebody that maybe you didn't have a job for at one point in time, but you're going to down the road. And if you think you're automatically going to be cutting out more than 40% of your talent with a poor experience, it really cuts into your ability to attract talent. On top of that, nearly a quarter, 22%, are going to actively tell others not to work there and to tell them about the bad experience they had going through the hiring process. And sometimes that candidate experience isn't just about what happens once they start talking to you. Really, now, candidates, they kind of want it all, right? They want to know that they are taken care of and that they are cared about and that they're important and that they're valued. And, you know, it's really easy for healthcare systems and organizations to get lost in the conversation around candidate experience and really take it to the extreme. And with everything else going on within the organizations with talent strategies and goals, it can sometimes feel a little bit overwhelming to feel like you have to do it all. So let's dive in and kind of unpack this a little bit about what does it actually mean? What do candidates really want? And I've broken this into 5 key areas. And there's lots of research out there going on a very regular basis, talking to candidates and what their expectations are. And at its core, it really is 5 things, and the wonderful thing about them is they don't have huge costs associated with them, and they aren't major overhauls often to organizations' budgets and processes. What candidates really want, one, is to have an idea of the culture and the values that you hold as a healthcare system or as an organization. And it's really easy to do that simply by making sure the information is on your career site and on your careers page. And when they go to your website, do you have a little bit of detail beyond just that job posting to talk about what it's really like to work there and what your organization cares about? I've seen some healthcare systems that we've worked with that have done a really great job of this, where really clearly on the career site page, they have pictures and stories of their current employees talking about the best thing that they love about their job, which often comes back to the patients and the involvement in the community and the values that they have from that perspective. Second, candidates really want to understand the process that your organization uses to hire. So simply put, again, just on your career site, tell them, what is your process? How does this work? So if they apply and they submit a resume, should they expect to hear from you in a day, in 5 days, in 10 days? Is it usually 2 or 3 weeks before somebody gets back to them? The timeline obviously matters a little bit, but the timeline matters less than just having some clear expectations up front. What we're seeing a lot of companies starting to do is put up front just a candidate service level agreement or just a little bit of an understanding of here's what our process is. Once you apply, we typically are going to review your resume, and if you're a fit for the role, we'll get back to you within a week, or we'll get back to you within 2 weeks, or whatever that number is that makes sense for you. And from there, you might have another interview or a panel interview, and then you go through onboarding and start. You know, it's very high level. It's not overly detailed, and it's almost a little bit generic, but it gives them a little bit more ease that makes them feel that you are thinking of them and that they have some expectations in line. So if they don't hear from you for a week, it's not because you weren't interested. It's simply because your process takes a little bit more time than maybe somebody else's does. The third is have an easy way to apply for a role, especially via mobile devices. We talked already about the impact of mobile, but can you make it easy for them to apply? One of the biggest challenges that I have seen with healthcare companies that I have worked with is that as we start going in and we're having the discussion around whether it is drop-off rates or what the challenges are, one of the things we have found is that they make the application process itself really long. And so they try to get every single drop of information, everything possible, where we're really seeing an industry trend to getting most of what they need, getting the basics, getting enough to make the decision, but maybe collecting some of the rest of it later on when somebody's actually going to be a qualified candidate. And then making it just simple, easy to apply, and via mobile. Fourth is feedback. This is, again, can be very extensive. I've seen organizations that have a goal to try to respond to every single person that applies. I'm a former practitioner. I was a recruiter. I can tell you we were unable to do that just because of the volumes and how lean we had to work when we were doing hiring. But it's something as simple as an automated email response. Thank you. We got your email. Here's our process. And you can almost hit 2 of these at once with that simple automated email response. It stops candidates from feeling like they're going in the black hole. Finally, is they just want to feel like somebody cared. Think back to when you took the job you have now, or a different job, or have you gone through the process where you really felt as you were interviewing that nobody really cared if you got hired or if you didn't? People want to know that they're valued and that they're going to be able to have an impact there. Going back to kind of the starting point of all of this, of how much impact can you really have before somebody hits apply? Well, once they hit apply, depending on the application process, 48% of candidates are going to drop out before they finish applying. And those are candidates that we know got to the point where they hit the apply button. These are not even the ones that you lost, if you remember this graph from earlier, way earlier on. So think of all of the candidates that you're losing much earlier on in the process because of employment branding challenges, because of the lack of information and really because of a perception that's going on out there. So employment branding. Why are we even really talking about this now? What is so different now than it was 5 years ago? So this is my favorite question that I get from more hiring managers than I get it from people actually in talent acquisition or in HR, because we see the market. But a lot of times I get, why does this matter now? Why do we care now? Well, strategically, it's becoming just more important. And so this is not a healthcare specific graph, but it represents kind of what's going on in the market. Long-term and securing long-term recruitment needs, we know that employer branding is having an impact on that. There's no outlook that we're looking at from a healthcare systems perspective that is saying that we're going to have a surplus of talent. Everything that I keep reading and everything that you keep telling me when I'm having conversations with you is that our challenges are only going to continue to increase. And so building these relationships now and starting this process now and developing a brand and developing awareness and perception in a very positive way about what it's like to work with at our company may not have the immediate impact in the next 30 days, but it is in 6 months, a year, 18 months, 5 years down the road. From an HR and a talent perspective, all of this has also shifted where we're starting to really spend our money and where our budgets are going. And more we're seeing budgets start shifting towards employment branding and partnering with systems that can help support that. So things like additional landing pages, so you can have a core landing page that is specific to recruiters or recruiting nurses, or a specific landing page for physicians, or specific landing pages for those nurse practitioners and other hard-to-fill roles, and even one for your hospitality workers and janitorial staff in other areas of the hospital. So each person has that unique experience. It's going to be more and more key. The employment brand and corporate brand are linked, and although we don't often consider healthcare systems as corporate or corporate brands, truly from an outside perspective, the brands are viewed very similarly. And so how employees feel that they're treated, how we talk about our employees, how involved we are in the community, all of this is becoming just completely intertwined more and more than it has ever been before. And so a lot of healthcare systems spend a lot of money on branding and marketing and inviting people to come in and choose them as their healthcare provider of choice. And from a HR and a talent perspective, we can really piggyback off of that and have those partner together in a really effective way. We don't see this as much in healthcare, but we do see it in healthcare suppliers that happen. You know, this merging of brands is becoming more and more important, and we're seeing things like the 10 worst companies to work for and the 10 worst healthcare systems and all of these different pieces. And in some of these cases, they use patient satisfaction scores. I'm starting to see them also using a cross between patient satisfaction and Glassdoor review scores. On the corporate side, they're using Glassdoor review scores. But there's no way that this type of a impact and getting put on this list isn't impacting then what we know from patients choosing us as healthcare systems. Employment brand has a bottom line impact from not just a patient satisfaction, we'll get into that, but just when it looks just at the numbers of recruiting. If you have a strong employment brand, you're actually going to drive 2 times as many qualified applications. And I think that's a really key differentiator here for us to just point out and talk about. There's a lot of sites that drive more applications. The challenge for us is that we're running lean. Healthcare systems don't have huge numbers of recruiters. You're not having people that are sitting around bored because they don't have anything to do in HR. Or you're busy and you're trying to operate lean and you're trying to operate really effectively. And so getting applications that are qualified and good is better than just getting more applications. And a strong employment brand helps drive that. And part of the reasoning for that is because as people can look and see what it's really like, what the expectations are, not only do the right people opt themselves in, but the wrong people often opt themselves out. And the theory and the thought of, we just want to get everybody in has really shifted to understanding that we want to get the right people in. Because it's not just about filling seats, it's about filling seats and filling roles in our healthcare systems that are people that are going to stay and people that are going to be engaged when they're working there. It also leads to a 50% decrease in cost per hire. Again, part of that is because we have better retention, and part of that is we have the people that are coming in. We're not having to spend as much time proactively being out there recruiting. We're not having to spend as much time trying to entice, and we're not having to have so much time of having those roles open and nobody being able to dedicate to the patient. The other real factor around employment brand and bad reputations in the marketplace comes down to dollars and cents. Companies with a bad reputation or a poor employment brand in the marketplace are going to have to spend about 10% more per hire. So if you happen to be a healthcare system, let's say with 10,000 employees, which is larger for sure, that can be as much as $7.6 million to make up simply for having a poor employment brand. So it is something that is impacting all aspects of this. The other real impact is on candidate engagement and the brand and the impact that has on the candidate engagement and their satisfaction coming in, which all translates to customer experience, which in healthcare translates to patient satisfaction. So this is a graphic, and it is retail, but it's a really great look and feel for the increase of employee engagement compared to customer satisfaction. And so the more engaged the employees were, the higher the rate of customer satisfaction. And even small differences scored 5% improvement for customer satisfaction in retail. And we're seeing that translate because who is your biggest customer? It's the patient. And based on patient satisfaction scores, hospitals can lose or gain up to 2% of their Medicare payments, reimbursement dollar values. There's a lot of money that can be left on the table by hiring the wrong people, by not having the right branding and awareness and getting the right people in the door to start with. As an aside, roughly 41% of patients seen in hospitals are paying via the Medicare reimbursement. We're going to dive a lot more into these stats and the engagement side on the third part of this series. So where do you start? It's really easy to talk about a candidate experience, an employment brand, and we need to do this and we need to do that. And I can see you thinking, yeah, but where do we start? This seems like a lot of work. We don't have time to add any more work. We don't have any budget. We don't have any. We just need to, we can't even do this. So where can you start to really start having some impact and not feel so overwhelmed trying to do it? So this is a great slide. It's got a ton of information, but I want to make it really simple for you guys to just get a quick glance at this. So starting points for part one of winning this talent war is assessing your ability to get the talent interested. First, what information is being shared about your company, and what is it actually like to work there? So first off, check your company's social media. If you guys as a HR department or talent acquisition department don't have social media, which a lot of healthcare systems, because of different regulations, don't allow that for their TA teams or their recruiting teams, see what your organization is doing overall. A lot of healthcare systems have something set up for social media, whether it's Facebook or Twitter or even Instagram, and it's really more focused on showing what is going on in the community and just their involvement from that perspective. Second, review your Glassdoor. Some of you may not have any information on Glassdoor. Within healthcare, Glassdoor is a little bit newer, but it is definitely moving quickly. But check it out, read the reviews, and try to really get a good gauge of what people are happy with and what they're not happy with. From a recruiting perspective, sometimes it's hard to read the reviews and look at, well, this is all for stuff after they get hired. I don't see how this relates to me. But it gives you a better idea of how you're positioning, how you're talking about what it's really like to work there, because it's always better to be a little bit more honest than to paint a rosy picture and then have turnover once people join. Third, what do your patient satisfaction, employee satisfaction scores say? And so this isn't something that you necessarily need to be out and advertising and that. You can, especially if you have a 4 or 5 rating. That's amazing and fantastic. But just look for your own information. I think it's really key for recruiting and talent acquisition and just HR in general to truly be business partners and understand what's going on within the rest of the organization. The second part of that is how much information are you providing to prospective employees? And so a really easy, simple way to do that is go to your website and go to your careers page. How easy is it to get through? Does it actually make sense? If you were a new employee, do you feel like you're getting enough information? Do you feel like it is a little bit generic, or do you feel it really reflects who you are as an organization? And do you share any details about that process or what those expectations are? And the final step of that is it easy to apply? Are you able to quickly and easily submit an application for a new role? Can you find openings? Can you even find a list of the jobs and what you're hiring for in a really simple, clear way? Do you have different landing pages going on for anybody that is a Cornerstone recruiting client? You get an unlimited number of these, what we call landing pages. And so you can set up basically a unique career site for every single one of the different hard-to-fill type of roles or different type of roles you have for free. And so you can do some of these things around employment branding without having a huge increased cost to your organization. And the other really simple thing is look at your implementation of your system. Do you have that automated response there? So if somebody does apply, they're getting something just to let them know that their application was received, a little bit more detail so they don't feel like it's going into kind of the black hole. And I'll leave this up just for one more minute so everybody can review. So we talked a lot today really about that first step of the process, the employment brand, the candidate experience, the attraction, getting people even interested to the point where they're going to click that button and hit apply. In part 2 of the series, we're going to be focused a lot more on hiring the right talent. And so how do we take the hiring process from apply to onboard, and really carrying people through that first week on the job and all of these different pieces that are coming into play and how they're all not only impacting whether people accept our offer and the perception of us as an organization, but how we can streamline that, simplify it so the process can be better for our hiring managers and our candidates. But then how does that all impact our engagement scores? How does that all get impacting on our patient satisfaction scores? And then, again, building engagement through the hiring cycle. And our final stage of this 3-part series is going to be really focused on engaging and retaining that talent that we hired. So how does that TA strategy impact the engagement and retention strategy? And then really diving in a little bit more and looking at referral programs and internal mobility programs, and a much deeper discussion of the impact of employee satisfaction on patient satisfaction and how that is impacting your organization. And we have a few questions that have come in. And so I would, if you have any questions on anything that we talked about today, or you want me to clarify or dive into anything a little bit more, please feel free to submit your question through the Q&A, and I will try to get through as many of these as absolutely possible in the next 10 or 15 minutes or so. So the first question I have is, do you have any recommendations on the best places to post jobs for RNs? They're struggling to get applications in. One of the things that I have found with various clients that we've worked with is that the job boards tend to be very location specific on what works. And so I try not to give specific suggestions on things like webinars, because I do know what works, for instance, in Chicago. It does not work the same as it does in Baton Rouge or in some other areas throughout the country. And so one of the things that I would really suggest doing is taking a look at your stats in your ATS and seeing where you are getting traffic at all from RNs, and then also where the RNs that you're hiring are actually coming from. More and more organizations are starting to, healthcare systems, are starting to reach out and address RNs as they are coming directly out of school. And they're starting to build relationships early on. And so even if they are not necessarily hiring RNs directly out of school, and they prefer to hire people that are going to be 3, 5, even 8 years, they start building some of those relationships at the collegiate level and at the program level, so that there is some brand awareness and things going in. And I'm sure the response to that is, that doesn't help us today. So it doesn't, that will help down the road, but you know, for today, look and see what is working and really focus on that. If you are struggling to get people to even apply, I would really strongly suggest coming back and taking a look. And I'm going to put this back on the screen here. I really would go back and take a look as to why you're not getting the applications in, because sometimes it isn't about posting the jobs. It's sometimes that people are not applying for a reason. And so having a little bit better idea, it would be helpful in this case, and feel free to write in the Q&A box if you have more details. But one of the things we would typically do is take a look at, you know, is it easy to apply? Are you requiring people to fill out and create a profile and a login before they can even apply, or can they just simply apply for the job? We have noticed a lot of shift for companies that used to have it where you had to create a login and a profile. When we simply move to not having to recreate that, we typically see an increase of applications. And also the language of the job descriptions. We didn't talk too much about this, but more and more we're seeing a shift. We saw it in the consumer side for a period of time, and the corporate side, where they would use the actual job description, and then it would change over from the job description into what we call the job posting. And children's hospitals and more pediatric healthcare systems really adopted this probably 3 or 4 years ago and have had some really good luck with this. But we're starting to see it in more general healthcare as well, where they're not posting the formal job description anymore. They're posting more of what we would call a job posting. And so it's got an overview of the role, but far less detail than a formal job description would be. And it's written in a little bit more of what we would call a marketing language, where it's more about enticing and encouraging them to apply and talking about what it's like to work there. It really is a sales tool to encourage them to apply, along with telling them about the role, but with a little bit less of the formality and detail. Of course, in the interview process, you still share the formal job description. That is still something that is part of it. But having a job posting really does often make a little bit of a difference there as well.
Hey, Sarah, I have another question that came in directly to me. So this is about comments on Glassdoor and Indeed. How do you handle negative comments that are posted there, especially for organizations that are in multiple states?
Yeah, you know, I think one of the worst things a company can do is get really defensive, and I have unfortunately seen that happen. It's the same if you're on Yelp, and if you see a bad Yelp review of somewhere or somebody was unhappy on Yelp, and then the manager or owner gets on and chastises them, it kind of makes you have a bad taste in your mouth, and you don't really want to go to that restaurant. The same can happen on Glassdoor. So you can obviously respond to negative reviews, and there's nothing wrong with responding. It's just how it gets done and not doing it in a defensive way. I think it's really important for people to take the negative reviews on Glassdoor and really kind of take them seriously. Take a look at them, understand, and read through it without feeling like you're going to take it personally. We have found there's some studies starting to be done that people actually feel more comfortable being honest on there than they do on their employee engagement and some of these other sides. And so if it seems like there's more negative feedback on there, a lot of times it's because it feels like it's a safer venue and it's less likely that it's going to get caught who it is, versus on employee engagement surveys, there's still some uncertainty as to how anonymous it really is. And so looking at it, really understanding if you are seeing trends in certain roles, if you're seeing trends in certain markets, if you're seeing trends for certain managers even, the same holds true with your employee engagement surveys that you do. It's really important to really start looking at those and addressing them accurately. But taking a look, taking them seriously and seeing what you're doing. One of the organizations, it was not healthcare based, but one company that I worked with in the past had poor Glassdoor reviews. And they were a really great company. They were struggling with turnover. People that had been there a long time were incredibly happy. But they still struggled with some of this for some reason, and they couldn't figure out to kind of pinpoint what it was. And as we really dove into it, one of the things that we found was that through the hiring process and through the recruiting process, the recruiting team and the talent acquisition team was really trying hard to create a perfect picture of what it was really like, or what it was like to work at the organization, versus really talking about what it was really like, where some of the struggles were and some of the challenges. And so people came in with different expectations of what reality is. And so if you're noticing a lot of trend, especially in people that are filling those out that have only worked at your organization within 6 months or a year that aren't positive, kind of look back at the interview process and how you're interviewing, how your employment brand is, how your recruiters are portraying it, and see if you're creating a disconnect between reality. From an employment branding and candidate experience perspective, one of the biggest mistakes I see companies do is they try to create a false sense of who they are as an organization. And they try to create an employment brand and portray a culture that isn't actually who they are. And it does create a disconnect, and it does create more struggle from an engagement as well as a turnover perspective in the long run. One other, just a comment that came in, that's a really great comment, so thank you for sharing this, is just, you know, they have found that candidates want to know which jobs they should apply for. And if they will apply for more than one, they would also like to be assured that they can reuse their information from one application to another. Absolutely. You know, I think it's really important to encourage, especially if you're an organization that is a little bit decentralized, if you want people to apply for every nursing role that might be a right fit versus applying just kind of for a more generic nursing role and then behind the scenes you kind of match them up to requisitions. It's really important to, again, share those expectations with the candidates up front so that they know that they should apply for multiple positions if it makes sense for them. And let them know, again, make it easy for them to apply from one to another. Sophie, any other questions that came in directly to you?
Nope, I do not have any other questions on my end.
Perfect. Well, thank you all so much. I am going to pop up my contact information in case anything does happen to come up. My email address as well as my Twitter is on here. Feel free to shoot me over an email or send a tweet, and happy to answer anything that happens to come up in the meantime. And hopefully I look forward to seeing you on Part 2 and Part 3 of our series.
Okay, with that, I would like to thank everybody for joining today, and this concludes our webinar. You may disconnect.